All right, good evening again, everyone. Welcome to the Impact Exchange. Tonight's topic is World AIDS Day, ending the HIV/AIDS epidemic. We'll be speaking about resilience and impact, and we want to make sure that we allow for great conversation. Like I said earlier, we have some amazing speakers to share their stories with you. And without any further ado, I'm going to turn over the floor uh, to our Zoom session right now to Dr. Alvaro Encinas, who is the Regional Medical Director at the Lake County Health Department. Dr.
Thank you thank you so much. Can everybody hear me okay? All right, good. Again, my name is Alvaro Encinas. I am a family practice physician. I just want to talk briefly about my experience with HIV. It was back in 2009. I was a second year family practice resident in New Jersey, and I was on my infectious disease rotation. And, we were seeing patients there in the clinic, in the infectious disease clinic, and I was seeing HIV patients. I wasn't paying much attention just because I thought, this is HIV, this is highly subspecialized. I'm probably never going to see it. I'm going to just stick to my cough and cold and, typical primary care issues. But I remember my attending pulling me to the side and saying, hey, you really should get comfortable with this because this is a chronic disease. Do you treat diabetes and high blood pressure? Well, HIV with proper treatment is a chronic disease, and you most likely will encounter it in the primary care setting. Fast forward about 8 years, I worked as the jailhouse doctor in Lake County, and it was one of my first days, and I was there starting to see patients, and one of our very first patients was HIV positive and on an antiretroviral medication. And I just said, okay, are we going to be referring out? I'm not too familiar with this. And my boss pulled me to the side again, and he said, this. Can you treat diabetes? Yes. Can you treat high blood pressure? Yes. Okay, then you can treat HIV. And with his guidance and attending some CME conferences and a lot of self-study, I became more comfortable with HIV. You encounter it. I've encountered it in when I worked at the jail. I work now here at the Lake County Health Department in the inpatient setting, in the in various type settings. Uh, Before I talk about the main thing I was going to talk about with prevention was just to give you some basic facts about HIV. What is it? It's just very simply put, it's a virus that attacks the body's immune system. Currently, there is no treatment. Once you get it for life. However, with proper medical treatment, you can suppress the virus and live a long and healthy life. How is it transmitted? It's transmitted through the two primary modes of transmission are um, sexual contact and through sharing needles to inject drugs. Those are the two primary modes of transmission. There are about 2 million HIV infections that occur in the entire world on an annual basis. Again, 2 million HIV cases in the entire world. In the United States, the most recent statistics I found was from 2018, and it listed as about 38,000 new cases in 2018. So just to show you that how many people, how many lives are affected by this one disease. When you talk about prevention, the first thing that came to mind was PEP, which we call post-exposure prophylaxis. If you or a family member has ever worked in a healthcare setting, and if you get poked by a needle, whether if you're doing phlebotomy or anything, or you're scrubbed into a surgery, the first question you ask is, is there an infectious disease? And, what are my chances of getting it? But with post-exposure prophylaxis, taking medication within a set period of time after possible exposure to the virus, you can significantly reduce your chances of getting HIV. But I'm not going to talk so much about PEP. I'm going to talk more a little about PrEP. That's pre-exposure prophylaxis, PrEP. This essentially is medication that you can take. Specifically, it's for individuals that are at high risk of contracting the HIV virus. The groups that are most at risk of contracting HIV are men or women without HIV who have a partner with HIV and have a detectable viral load. The second group are men who have intercourse with other men, MSM, who in the last 6 months have engaged in high-risk sexual behavior. High risk we would define as intercourse without the use of condoms. Specifically, intercourse without the use of condoms with multiple partners. And the third group are transgender women who have intercourse in the last 6 months with individuals who practice high-risk sexual behavior. The two medications that are available for PrEP, for pre-exposure prophylaxis, are Truvada and Descovy. These two medications, the use of these medications by individuals at high risk of contracting the virus, they can decrease their chances, obviously, of contracting it. But it's not that simple. There's some important things to keep in mind. Is that obviously the person who's taking this medicine for PrEP, they have to be HIV negative. They obviously have to be individuals that are high risk of contracting HIV. They have to have normal kidneys, and they have to be committed to daily medication use. Some patients I've talked to that thought that it was something that you can use as kind of like on an as-needed basis, use it on the weekends when you may be more likely to practice in high-risk behaviors. But no, you have to be committed to daily use of this medication, either Truvada or Descovy, in order to decrease your chances of contracting the virus. I think prevention, when we gather today for World AIDS Day, to end this HIV epidemic, it comes down to prevention. As a primary care doctor, we always talk about preventing heart attacks, preventing strokes, and if we want to prevent HIV, I think is PrEP is the one thing that as primary care providers, as HIV providers, we really should be pushing this to the right individuals in order to stop the epidemic. That's it from me. Thank you so much.
So thank you, Doctor, for the clinical understanding of what HIV/AIDS is. Our next speaker has quite a story. He told us when we first talked to him a couple weeks ago when we were preparing for tonight's program, he doesn't want anyone to feel sorry for him. He wanted people to take his message that he is going to deliver tonight and be uplifted by it. Although the circumstances that he is going to discuss are pretty dire and significant, he did make sure that he prepared comments so to not forget anything he wanted to say. And once Jason has completed his presentation, then we're going to turn this over for Q&A, of which I will moderate. So without any further ado, we're going to turn you back over to our guest speaker. Next one is Mr. Jason Hart.
First, before I begin, I want to thank Vicki and David for allowing me to speak today. Thank you. Hello, everyone. Glad to see your beautiful faces. My name is Jason Hart. I am with the Lake County Stands Against Stigma. I am also the founder and president of Lovable Ministries. We are a ministry that works on healing this broken world. Today, I come to you to tell you my experience of facing stigma and fighting back because of the fact I was diagnosed with HIV in 2013. In early January of 2020, I decided to visit my family my sister in Mississippi, and will face stigma like I never have before. I apologize, I'm kind of nervous. After week 2 of my visit, I was incarcerated in a small town in Mississippi called Calhoun County. Before my arrival, my sister told the kids in the neighborhood that I had HIV. To their credit, instead of just believing my sister, they came and asked me if I had AIDS. I told them I was HIV positive. They did not understand the difference and decided to call me AIDS boy until another kid would speak up for me weeks later. That was my first encounter of ever facing outright stigma. Then my sister's boyfriend locked me out the house and left me in the rain. I then walked in the rain from 9 a.m. to 5 p.m. After a long day with no light in sight, I would walk into a church, thinking the church would help me. The church called the police to see how they could help, but instead the police arrested me for disturbing the place of business. I ended up telling the police my status, and they placed me in solitary confinement. For 6 days, I was in a cell without a shower because of me being HIV positive. My disease was treated as a crime that I had no control over. Then this past summer, a friend refused to eat after me, and her reason was because I was HIV positive. I started falling in her trap, stopped taking my critical HIV medication because I wanted to stop having HIV. I prayed and prayed that God would free me of having HIV. I allowed the stigma to allow me to be someone I am not. This stigma gave me the false perspective that I was not normal because I was HIV positive. I am greatly appreciative of the support I received when I would return home. Like I said, I gave up and stopped taking my critical HIV medication. I will admit, I struggled this past year with my HIV diagnosis. This past summer, I met my 15-year-old neighbor who would become a critical part of my life during this time. We play sports, we watch sports game, and even have brotherly talks. I then told him my status. He treated me like a brother and not a disease. He was so supportive, he wanted a shirt that said HIV. This kid started showing me HIV does not define who you are. Because of his support, I am refusing to give up, and I am proud to say I am back on my HIV medication. Do not allow them falsehoods to change who you are. I join Lake County Stands Against Stigma because this fight is personal. I will not allow the stigma I face to define who we are. We will not be silenced by this stigma, and we will be exactly who we are. I come to you tonight and I ask you to join me, and let's defeat this stigma by not allowing this stigma to defeat you. We are not our illness. We're not our illness. We are not our illness. We are normal human beings with a heart and a spirit. Be positive. We are no different than anyone else. Let us stand up against this stigma and let us defeat the great darkness before us. I love you for exactly who you are. Don't stop taking your medication because then you are just giving the power to the stigma. Be yourself and never shut down. We will win against this stigma by taking our medication and being unapologetic of who we are. Stigma is a dangerous weapon, but don't forget to love others as you love yourself. We are humans and we all have a one-of-a-kind heart. Use our heart and be kind to others. I choose to speak out on my experience because I refuse to allow the stigma to control me. I love you for who you are. I know your higher power is proud of you, as am I. May you all have a blessed night and stay safe during these times of struggle. Again, my name is Jason Hart, the founder and president of Lovable Ministries. If you ever need an ear to listen, I am here for you. And you can find me on Facebook at Lovable Ministries.
So thank you, Jason. I appreciate your candor and your courage to speak on behalf of your diagnosis and the courage that you have to move forward with positive momentum and energy. So this is where we will begin the Q&A portion of today's conversation. And I usually begin with some prime questions. But today, when I was looking for positive memes to post on social media, I found one that was very topical for today. And it is a quote from none other than Elizabeth Taylor. And it says, "It is bad enough that people are dying of AIDS, but no one should die of ignorance." And I thought that was perfect timing for today and our conversation. So I'm gonna put the first question out to Dr. Encinas. So coming from your practice to the jail, to the Lake County Health Department, you've amassed quite a collection of stories, probably, and of course you can't share them. And you kind of touched on it earlier when you spoke about, what's that? Oh, yeah. Okay, we'll get to that in a moment. So we just got a chat question, but we're gonna move on. So Dr. Encinas, you've amassed quite a collection of stories, and my question to you, Vicki talked about isolation. We're already dealing with pandemic. We're already dealing with quarantine. What can you say to us through all of this that would help address our mental health, not just through HIV/AIDS, but also just the pandemic that we're in right now?
I'd say, mental health is, probably the one thing that, we really need to concentrate on this pandemic. We worry about the physical health. We worry about contracting, when we're talking about COVID-19, but we don't think about, all this isolation, not having contact with our close family, friends, our parents, our grandparents. And, like, for example, we just had a big holiday, Thanksgiving, which is a time when we tend to gather with our closest family and friends. And we saw how, instead of being, in my case, I would have been with 15 other people, but now it was only just myself, my wife, and my kids. And it's, it was kind of sad for me because I was having a Zoom Thanksgiving with my parents, who, obviously are older, and I don't want them to get it, especially if it's because of me. So it's our mental health is probably what we have to concentrate on, connecting with friends. I've had friends from college and high school who I've, when I want to see them, when I want to talk to them, I'll see them, but obviously I haven't seen them in several months, and I've been Zoom calling my friends that I've never done that before in my life. And I've known some of these people for, 20, 30 years. But, that's it. You think about it, you're like, oh, well, if I want to talk to that person, I can just call them. But no, seeing the face, talking to them, really helps your mental health, helps you, gives you some type of normalcy, whereas even though you can't see them, or at least it's discouraged to have gatherings with friends, but at least you can spend some time and bring a smile to your face. You can bring a smile to your friends, but really I think it's the key right now is with mental health is staying connected. And thankfully, we're in a time where we have technology that can help assist us to do that. I can't imagine how it was 100 years ago during the pandemic of 1918, when there was no such thing, telephones or Zoom videos. That was not a possibility. People, they quarantined by themselves. So now we can, here 102 years later, we can use technology to our advantage to help keep our mental health, to keep us going, most importantly.
It is critical. We're finding that the mental health aftermath of all of this has just been so detrimental to a lot of people, and to feel isolated is the worst thing, and to be able to offer some kind of connection and communication it's been key to me, and I know a lot of people that we work with. So, thank you for pointing that out, as well as keeping everybody's health, physical health and mental health together. It's important.
So that's an important segue. We're not going to ask Jason any questions related to his diagnosis or any of that. We admire his courage and his candor that he's already shared with us. But when we were pre-interviewing Jason to prepare for tonight's conversation, he spoke at great length about him seeking out his artistic endeavors to find purpose and create meaning to his life. So Jason, can you talk a little bit about how art influences and plays a big role in your life now?
Yes, art is the big reason I am able to be healed, and big reason a lot of people are able to be healed, because with art we are allowed to express ourselves. We are allowed to express ourselves when we don't have the words to express ourselves. It is a way that we also can take out our frustration when we scratch paint on a piece of paper. We allowed to express our anger and our frustration. I think art is a big part and a big reason why mental health institutions has art all over the place, is because art is a big healing method.
Thank you, Jason. So I'm going to refer to the experts other than Dr. Encinas from the Lake County Health Department to tell us, maybe this one goes to Kendall. Kendall, can you let us know a little bit about the resources that are available to folks, maybe families that are addressing this concern, or people that are new to the area that maybe need to rely upon these types of resources at your facility?
Yeah, so we are really lucky in Illinois. Just a little bit of HIV history. Back in the 90s, and maybe Sarah or Valerie can correct me because they were much more aware of the 90s than I was. There was a kid in Indiana named Ryan White who passed away of HIV. He was 12 when he got a blood donation that was HIV positive, and he was 19 when he passed away. So all of the federal funding that we have for people who are living with HIV and people who are vulnerable to HIV are called Ryan White dollars in his honor. And here at the health department, we are what is called a Ryan White clinic, where we have access to free or discounted medications for all people who are living with HIV or who are vulnerable to HIV. So even if they do not want to come here to the health department, we can help them have access to those programs to find specialized doctors. But here at the health department, we have access to 3 providers for people who are living with HIV that are also primary care providers. So sometimes people who are living with HIV go to like an infectious disease specialist for their care, but we don't need them to do that here. Also here we have access to PrEP and STI services, as well as case management. Sarah and Valerie, I'm missing a whole lot of services, but we partner with Catholic Charities of Waukegan as well for case management, as well as some mental health services and a specific food cupboard called the Care Cupboard for our clients. We have so many support groups. So we have an English speaking support group and a Spanish speaking support group for people who are living with HIV. We also have a support group for young and gay, or gay and bisexual young men who are, you know, between the ages of 14 to 25. And then I also facilitate a group for people who are transgender. So people in that group might be HIV positive and might or may not be HIV positive, or they may be high risk and vulnerable to HIV. We also partner with Ascension Amita Health in Waukegan for the harbor, so that we have housing services specifically for these people as well. These services have definitely changed over time, but we're really lucky here in Waukegan that we have access to so many wonderful organizations such as us and Catholic Charities and Amita. Also here at the health department, we have a needle exchange program for people who use injection drugs. We have a program where they can come and drop off their dirty syringes and collect new syringes so that they can keep themselves and anybody that they use drugs with safe against anything else. We also partner with the VA. So the VA is one of our close partners that is a part of Stands Against Stigma. And that we are able to all be in a network that is people downstate are very envious of us and how communicative we are with one another. And really, I think the ultimate message is that if there is a need for people who are living with HIV or who are vulnerable to it, those of us here and our partners across the county will find a solution to that problem for that client.
Awesome.
Anybody else from health department want to chime in? No? Okay.
I was going to say, Kendall, thank you for saying that, because it's, you know, we will, that is kind of the whole purpose and the drive of Stand Against Stigma, is to ensure that we are all using our resources to really serve our community. And that's really, really important for us to do that, to make sure that we can find help for whoever may need it, regardless of, you know, where they come from or who they are, that we're not turning anybody away for any reason. And one of the things that we at the health department do as well too is we make sure to stay really connected to what's going on at the state and the federal level as well when it comes to ending the HIV epidemic. We're very active partners and planners for Getting to Zero Illinois, which is a plan to end the HIV epidemic in Illinois by 2026. And so that plan is online and really accessible. And we always encourage people that, when you get a huge plan with all kinds of goals and objectives, you never know where you really fit in that. And it seems like a very big, heavy lift to move the marker. And we just always encourage people to look at it, find one thing on that plan that they say, you know what, this is the one thing I can impact, and this is the one thing I'm going to work on, and then they can move that forward. And so that we're all an active part. And it's really nice because it's in both English and Spanish as well.
Great, thank you.
Thank you, Valerie.
For that insight. I have a really quick question myself for Dr. Encinas, in that I had mentioned that Art Impact Project does do programming directly with inmates in the pods at the Lake County Jail. Not right now because of COVID, but we have been working with them for a year. And myself and Murag, one of our other advocates, just waved to us. I have a question, in that we obviously don't know the inmates who have these diagnoses, but if somebody were to ask about or reveal this information to us while working with them, would we be able to, are they aware of resources to them when they get out of jail? Like all of these programmings that you're talking about at the Lake County Health Department. Is there a way, because we have referred people to Bridge House before when they get out, is there a way that we could provide that information, or are they clearly provided with resources for when they do leave the jail?
No, I don't know specifically everything that they are given. I know, they're given vouchers for medications that they were on when they were incarcerated, so that they can have a supply until they see their primary care providers. But as far as other resources and whether they find out about the resources in the community, in the county, I can't speak to that. I'm not aware exactly of what resources they're given.
That would be something to look into to make sure that, I'm sure it's not a huge population, but for those that are there and they, do have this health issue, when they get out, where do they go? Where do they have the opportunity to understand what resources are available to them? So
I can chime in on that, Vicki. Oftentimes, so we have here at the health department, we have a standing relationship with the jail medical unit, where most of the time they alert us if the client discloses to them that they are HIV positive and needs medication, which we know can be a difficult process. Jason told us why that might be scary for them. The jail medical actually alerts us that they are there and that they might need a medical appointment with us. So sometimes those are people who have been our patients for a long time and happen to be in jail. Sometimes those are people who got picked up in Lake County but are Wisconsin or Indiana residents, and they're going to be with us for a little while and then go back to their home state. And sometimes there probably are folks who are in jail and don't tell anybody at jail that they are HIV positive. So that's definitely a population of people that we could do better outreach to, for sure.
okay, great. And we did have one question from Michelle. If we can unmute you, would you like to ask your question?
Sure. I was just curious as to what you do. You have amazing programming. It sounds like. I'm wondering if in the Lake County schools, if there's education provided around the programming.
Lake County people, who wants to take that answer?
Valerie, Kendo.
I don't want to do it. I don't actually
I'll go
know.
ahead. So I was going to say that we do some education for social workers and teachers and nurses once a year. Well, for nurses and social workers once a year, that we have a big conference for them that's put on that kind of goes over all the basic health information. And we do have some opportunities where we do go into the school, not as much since the whole COVID thing has happened, but we do have some programs that work with teens and people at the school level. Some of it's changed a little bit since COVID's happened. Other than that, all of our services here at the STI program are open to people 12 and older. We also have women's health family planning services where people can get and learn about different parts of our program as well. And sometimes some of those referrals actually come from teachers, social workers, school nurses.
One of the things we do too, in addition to that, is our school-based health center. We have one that's located in our Round Lake High School. They are also a PrEP provider. So that nurse practitioner out there who has an STD clinic, and then she identifies those who are vulnerable to possible HIV infection. She refers them for support groups and can prescribe PrEP right then and there, because PrEP is available to teenagers without parental consent or permission. And so they're able to do that right then and there in that location. And one of the things also that we work really hard here at the health department is in the Getting to Zero plan, there is a lot around sexual health education at the high school, at the junior high and the high school level. And then we also partner with other agencies that are trying to rewrite the sexual health education curriculum and laws in Illinois so that it is more encompassing and comprehensive.
It's a wealth of resources, we can tell. Great expertise from the Lake County Health Department. And it's amazing that we're able to get all of you together for the same conversation for everyone to participate in. But I want to just move back a little bit, and I'm going to ask Dr. Encinas. You're under a lot of pressure. It's pretty apparent. You have a very stoic face right now, but what do you do to unwind?
What do I do to unwind? I got a 7-year-old and a 9-year-old that sometimes when you have stresses at work and you're doing, seeing a lot of patients, COVID testing, and then you come home and my daughter just wants me to help her draw, things like that kind of, just take me out of the work zone and remind me that I'm a dad too, and that it's important to spend time with my kids, and it kind of helps kind of refocus, and of course just working out, right? Just going, working out, playing basketball. Those are probably the other two things. Spending time with my family and working out are the two biggest things I use to unwind.
Awesome. So I was wondering if there are any other questions from folks in the audience here. We have great expertise assembled for all of you. Otherwise, we'll keep the conversation going. Anything? Anybody? All right. So this one goes to Jason. Again, we're not going to talk about your diagnosis or your any of that other stuff. But Jason, so you have moved around a lot, and you call this area home. What do you like about this area that sets it apart from where you've been other places?
Lake County Health Department, the Valerie, Felice, everyone said it very well. It's a place that cares about other people. I spoke about my experience in Mississippi. There wasn't a care in the world about me. But here in Lake County, people actually care. Kendall, Felice, Valerie, Sarah, Joe, all the people that I met in Lake County, including Michael Nerheim, the former state's attorney, they all care. They love the people. They care about people. And that's what set this county apart from others.
Thank you, Jason. I had a feeling you were going to say something like that. So I have a question, probably maybe towards the folks at the Lake County Health Department. Kendall, maybe we have quite a VIP cast of characters assembled for tonight's conversation. I know some of them are from the Stand Against Stigma Coalition. I was wondering, what could other people do to maybe get involved with that effort or any other initiatives taking place at the Lake County Health Department that would help create more purpose in their lives, or maybe to spend some of their free time helping with some kind of core mission?
Yeah, absolutely. So we're always looking for new members of Lake County Stands Against Stigma. It's a group that previously met once a month. In COVID, we have been looking towards meeting maybe slightly less frequently, but something that has been one of our focuses that we just really haven't had the person power for a long time is putting together our own speaker series through Lake County Stands Against Stigma that could potentially go and do HIV education series throughout the community and even, in school classrooms. So if getting connected with Stands Against Stigma is something that people are interested in, I would encourage you to absolutely reach out to myself or Felice Carabello, who is so kindly helping Jason with technology in our front office. Sarah, Felice, Valerie, what am I missing as far as initiatives at the health department or ways to get involved?
I think you said it really well, Kendall. I would just add on when it comes to the Speakers Bureau that I think, what we're talking about today is really exemplifies the power of hearing people directly impacted by HIV, and when they share their story, how it can make such a big difference. So working at the health department or working at any of our partner agencies, we know that we can go into classrooms or go to groups and talk about, what we do day after day, but it's not the same as hearing from folks who are directly living with the virus or directly impacted. What's hard is stigma, is it's scary and it's difficult, and not everyone, wants to share that, and that's understandable. But when we do share those stories, I think that's the best way to reach young people. I think it's the best way to reach our community. I know it's changed my life hearing people share their stories. And I'm so grateful when people do feel comfortable to share, because I know it's such a challenging thing to do. But yeah, as we build that up, that's, I think, one of our biggest initiatives we'd like to accomplish.
I think that's going to lead to my next question. As art advocates who are working with our participants and going out into the field, hearing these stories helps to educate us so that we're more aware, we're more accepting. Hopefully we are able to relate better. So I think I'm going to speak for maybe any of our advocates who are here. Is there anything more that we can understand that you can share with us, Jason, Dr. Encinas, the health department, anybody else who might be a guest here, that would help us to be better advocates when we're conducting our programming? Is that a fair question?
I know as an art advocate, I've heard stories that I can't share with you, any of you, that have brought me to tears. Young people who are wise beyond their years and have learned some very tough lessons at a young age. And even as an older fella like me, I was not always prepared for those types of frank and honest conversations, because they come at you when you least expect it.
So yeah, that it just helps us to better have welcoming open arms for those that we serve.
If I can, I would like to say something. My name is Veronica Press, and I work at the Lake County Health Department as a health educator. And yes, hearing those experiences, I volunteer with Sarah to Camp Kindle, where you meet a lot of individuals, kids that are positive, and we got a lot of stories that, once again, made us cry. But I think little by little, we're getting there, sharing all that information in every possible way. So one example is like we are focusing this program, but at the same time, all of us in different areas try to reach as many individuals as we can. Yesterday, through the Highwood Public Library, we did a Facebook Live remembering World AIDS Day, educating the Spanish-speaking community, and we got a lot of questions, a lot of parents that, oh, I never had heard any of this. I never knew of HIV. I thought that was not near me or my family or anything. So little by little, doing all of this, presentations, conversations, and all of this, trying to do it on Facebook, Instagram, whatever we can, try to reach as many individuals as we can. We're actually doing a great job. One person, two individuals that we can reach out at that particular moment will be one less person that be kind of like having that stigma or thinking about that different way because we're not educated enough. So I think we're already doing it, but can we do more? Definitely.
I just wanted to add one thing really quickly too, is I hearing a lot of people hearing stories and making connections in the community. One thing that anybody in the community can do is, if you have a friend, an associate, a coworker, a family member, you guys can always help them by doing a warm handoff. You can call any of us up at the Lake County Health Department and do what we call a warm handoff. Make an introduction. If they're willing and they're ready, we're more than happy to meet people where they're at and at least start the conversation. But sometimes, you know, even that is a way that you can help people.
Okay, cool.
I think, you know, what Veronica says, for every person that we touch and we talk to, they will then turn around and talk to somebody we may never be able to reach out to. And so it's like a giant web that kind of goes out into the community, and talking about it more. I mean, when you start to see, you know, commercials for things like PrEP, or commercials on U equals U, you know, undetectable is untransmittable, commercials for medication to treat HIV, all of those things, that constant talking about it and educating people breaks down that stigma, and it just gives people hope, right? Hope that we're moving forward, hope that stigma will end, hope that there is something beyond. And so all of that is just, it's been, you know, just an absolute gift to be able to do this work. And so
And I want to add something to that, because just by having meeting like this with all of us is actually helping. And I remember, probably Sarah will remember this, when we had paper charts, not electronic medical records. Many, many years ago, we came across a chart that was divided. And at the very, very, very end of that specific chart, there was a hidden envelope. When we opened that envelope, those were HIV results. And that individual was like HIV positive, and it was totally hidden from the medical record chart. Nowhere in the front was like written HIV. And I think by separating that, we're creating that stigma. And when we become together, so if you go see mental health, but you do not address the HIV, then we're not doing our job right, because probably those mental the problem that the individual has with mental health probably has to do a lot with this HIV diagnosis. And vice versa, if we have HIV patient and we do not address mental health, we're not serving the patients well. We have to see the patients as a whole, and then see the whole picture, and not just, okay, I'm a mental health provider, I'm gonna focus on this. Or I'm an HIV provider, I'm gonna focus just on this. Because everything affects the outcome. And I think approaching it, asking those questions, talking to each other, referring them to every single program, that's a start. And by doing this, we're already doing it.
You know, the biggest thing, when I was in Mississippi and I was in the jail cell and I experienced the stigma, the biggest thing I noticed is misinformation, people not having the information. And I think as health educators, and I think people need to be better educated, because again, the reason why I was in confinement was because they was afraid that if I got in a fight or something, that I would spread HIV to the rest of the people in the cell block with me. But misinformation is the biggest problem.
True. That's true. Thank you.
Thank you for, again, chiming in on that, Jason. We continue to appreciate your candor and willingness to share these stories with us. We're very grateful to you. So we're about an hour. We try to hold these conversations to about an hour. Are there any other questions from folks in the squares assembled here? Well, I'm going to ask then probably Kendall or Felice to say one last question for me. Where could people find more information about how to contact you and your programs at the Lake County Health Department?
So anybody can contact us here at the Lake County Health Department at 847-377-8450. If they don't feel comfortable calling, they can
We have a website and also a Facebook page.
Yes.
Social.
And then I was going to also say that if they have questions, you know, they can always pick up the phone and give us a call. And that's how we start. And then they have questions about other services like Catholic Charities. It's at 847-782-4000. And they can also talk to people there about other services that they might need as well.
Thank you, Felice.
Oh, and Lake County Stands Against Stigma, that's also the way to get involved with the Lake County Stands Against Stigma group as well.
That was
847-377-8450. And we do also have a Facebook page. Kendall?
Okay.
Oh, I lost my view.
Yeah.
Yeah, I just sent it. It's the Need to Know, Lake County Stands Against Stigma Facebook. And if you Google Need to Know, the number 2, if you Google Need to Know Lake County, you can also find our program's website.
Excellent.
So I'm going to leave one of the final words then from Dr. Encinas. Can you leave us with some final wisdom for this evening's conversation?
Absolutely. You know, we're talking about world, you know, the significance of today. We talked a little about HIV and how it's affected, you know, how we view it and how we need to work to remove the stigma. You know, and just understand that that HIV is a chronic illness. It's like diabetes and high blood pressure. Of course, if we want to end the HIV epidemic, it all starts, in my opinion, with prevention. Education and prevention is how we can end this epidemic.
Thank you, Dr. Encinas. It sounds like you have quite an educational team assembled here tonight from the Lake County Health Department. So I wanted to give a quick shout out to everyone that helped prepare this. But Jason, final word from you.
Have a blessed holiday, everyone. And great to see you all. Stay blessed.
Thank you, Jason.
Thank you,
So
Jason.
I wanted to say a big thanks to Felice Carabello, Kendall Lake, Hannah Goering from the Lake County Health Department, of course, Sarah Zamora, hello, Sarah, and Ali Benj, who is from Art Impact Project, Josue Pasillas for helping to promote the site's this evening's program, and of course, Vicky Marasco, and I'll leave the last word to her.
Oh, geez. I also want to thank everybody for joining in on this conversation, and especially our board of directors. We have several here present with us tonight, and our art advocates who are always willing and wanting to be educated on the topics that we encounter when we are working with our participants. It is a broad range of topics that we cover. So we're always wanting to learn more. You know, there's no set training for some of these situations that we go into, that we more educated, more aware that we are, the better we can serve. And so we thank you, Dr. Encinas and Jason, for bringing these things to light, and our partnership with the health department. We're really grateful. So I just want to say good night to everybody, and thank you so much for participating. If you have any questions about Art Impact Project and you want to learn more about the health department, you can contact us and we can put you in touch with them too. So thank you.